Hello, my beautiful friends. Today we're going to discuss blood sugar and diabetes. And here you see two of my diabetic clients, Greg and Nora, and we'll talk about them in just a second. I know each of you knows about the importance of controlling blood sugar for diabetics, but maybe you don't know how important it is for all people to control our blood sugar. The lower we can keep our blood sugar, even when it's within the normal range, the healthier we are. Having a chronically elevated blood sugar impacts your energy, your weight, and your overall health, and it can lead to a lot of chronic disease. So today we're going to discuss how a low-carb diet benefits everyone, not just our diabetics. There are 30 million adults in the US with diabetes, and another 10 million that are out there who have all of the symptoms and haven't been diagnosed. Plus, there's another 130 million people who have pre-diabetes or insulin resistance and may not even know it. And we're discussing all this because my Jumpstart program is about to release. And that's the program that helps you reverse all of these problems. We started in our first week with talking about all the weight loss stories because that's honestly the one that captures the most attention. And admittedly, that's what I was looking for when I started all of this. I needed to lose weight myself. But then as an ER doctor, I started realizing all the other benefits that come with fixing your metabolic health. We talked last week about how I taught my husband to eat low carb and fixed his heart health. Last week's video here on YouTube was all about dropping your blood pressure and correcting your cholesterol to drop your risk of heart disease. If you want to learn how to analyze your own cholesterol, check out that video. This is my oldest brother, Patrick. He's the one in our family with the sweet tooth, and he's the first one who developed diabetes. He's also my first client that completely reversed his diabetes by following a low-carb diet. He's a US Army veteran, and I'm pretty sure that those MREs he was issued, the ones that are super high in sugar, did not help him. His doctor at the VA still insists that he eat more sugar so that he can stay on his diabetic medication. Yes, his idiot doctor and I do not see eye to eye, obviously. Okay, let's talk about Nora and Greg, two of my diabetic clients, and we'll use them to illustrate the difference between type 1 diabetes and type 2 diabetes. Greg is actually the husband of one of my clients who benefited from the program. His wife, Janelle, wanted to maximize his health, so she joined me and learned how to help him. And you can see he's more than happy with his results. Not only did we get him in better shape, but we have literally saved his life by getting his blood sugar under control. Okay, so Greg is a type 1. That's also called juvenile diabetes or childhood diabetes. This is an autoimmune disease. It's genetic. In type 1, our pancreas doesn't work well enough to make insulin. And before insulin was created in the 1920s, the only way to keep these patients alive was to keep them on a low sugar diet. Exactly the diet I teach. So even though we can't cure Greg, we can definitely make him healthier by keeping his blood sugar under tight control. The majority of my diabetics are type 2 diabetics like Nora. Type 2 diabetics typically have an adult onset. Although because of our terrible food climate in the US, we diagnose a lot of teenagers as type 2 diabetics. This means they have developed insulin resistance and have metabolic disease. This is the type of diabetes that is completely reversible by just eating right. Type 2 diabetes is more difficult to diagnose because the symptoms come on over years and decades rather than quickly, as in the case of type 1 diabetes. All people should be looking out for and be aware of the symptoms of diabetes, especially if you know that your risk is high. Symptoms include increased hunger, increased thirst, unexpected weight gain or weight loss, extreme fatigue, slow healing wounds, a numbness in your hands or feet, blurring of your vision, needing to pee often, or very dry skin. The number one risk factor for type 2 diabetes is being overweight, especially being overweight around your belly. For men, having a waist circumference of greater than 40 inches puts you at very high risk, and for women, this is 35 inches. The other things that put you at high risk are lack of activity, a very unhealthy diet, family history of the disease, or age greater than 45. But like I said, we're seeing it younger and younger. If you have a Scandinavian background, you're actually at much higher risk for type 1 diabetes. Those at highest risk for type 2 diabetes include Hispanics, Latinos, Native Americans, Pacific Islanders, and Asian Americans. Women who had diabetes diagnosed during their pregnancy are also at very high risk later to develop type 2. And those with polycystic ovarian syndrome are at high risk as well. Because of the connection with metabolic disease, those who have high blood pressure and abnormal cholesterol are also at high risk of developing diabetes. This is a page straight out of the workbook from our Jumpstart program where we are discussing metabolic syndrome. For the diagnosis, you need at least 3 of the 5 that we see here. So high blood sugar, high blood pressure, low HDL, high triglycerides, and excess fat around your abdomen are the 5 diagnostic criteria for metabolic syndrome. Now, if we go back to looking at your risk factors, you can see that by correcting metabolic syndrome, we take care of 5 of those risk factors. Then typically when my clients get more metabolically healthy, they have more energy, and they will also increase their physical activity. And we talk often about how family history doesn't just include genetics, but also includes the way that your family eats. So sometimes when we correct how one person eats, especially if they're the cook in the family, we can correct these things for the entire family and change the history of your family going forward. Of course, a low-carb diet can make sure that gestational diabetes never happens. And if you're a woman with PCOS, you should know that a low-carb diet is the treatment for your disease. Now check out this headline. Nearly half of the US population has diabetes or prediabetes, and many of them have no clue. Are you among them? You can see from these maps that between 2004 and 2021, our rates of diabetes have gone up significantly. You'll notice in the Deep South, we have a diabetic belt developing, and this closely matches what you'll see for the rates of obesity, heart disease, and cancer as well. These are all metabolic diseases that we reverse by going low carb. When we prevent diabetes, we prevent all of the complications of diabetes from happening. This includes blindness, loss of limb, chronic nerve pain, accelerated heart disease and stroke, frequent hard-to-treat infections, the development of high blood pressure, and kidney disease. Diabetes affects every organ in our body, including our skin. Just by controlling your blood sugar, you can make your skin look more radiant. We accomplish a low-sugar diet by learning all about our foods. I teach my clients right up front how to read food labels and what to avoid. Then, of course, we don't just focus on getting rid of cookies and candy. We dive right in to discover where is the sugar in our real foods. This includes learning about which vegetables are high in sugar and what fruits to avoid. If you want to learn this in detail, I have another YouTube video entitled Low Carb Basics and Beyond. Here's a graph I like to use with all of my clients. On the x-axis, you'll see sugar in grams. So this is how much sugar you take in a day, from 0 to 400. Average Americans tend to take in above 300 grams of sugar a day. And on that y-axis, you'll see weight. The higher you go up, the more you weigh. This is measured on the graph in terms of your BMI. And that's something that I help my clients calculate and understand right away. The higher your BMI, or the more you weigh, the more insulin resistant you are. And that's what you see written on the lines there. The red line on the bottom says mildly insulin resistant, whereas the green line at the top says morbidly insulin resistant. If you're very overweight, you can guarantee that you're also very insulin resistant. And you can see from those boxes on the right side that if you're trying to get down to your ideal weight, the more overweight you are, the more it's necessary to control the sugar that you take in. This graph helps anyone who is trying to get healthy or wants to get to their healthy weight understand how the sugar they eat plays a role. My Jumpstart Sugar Detox program just released, you guys, and I'm really excited to share it with you because it's going to help you reverse any of these problems. You get 14 days of interacting with me, my coaches, and your team on the app, a full color workbook to go with the program, video lessons every day throughout, plus an AI coach and a free member support group. And you'll get 3 bonus gifts. The first one is a video shop with me plus a grocery list. I'll teach you what to grab off the shelf and what to leave behind. You'll also get my low carb lifestyle pack. This includes our cheat sheets of low carb items to hang on your refrigerator and everything you need to stay on track. This will include a daily tracker, a monthly log, and you'll even get an Fix calendar. Plus, you'll get my first cookbook with over 65 low carb recipes. And finally, you'll get my sugar withdrawal treatment packet to help you break free of that sugar addiction easily. So for 14 days of interactive training with me by phone, 14 days of connection with a supportive team, and AI support, plus an 80+ page workbook, membership into my private Fix Nation community, and my 3 bonus gifts with everything you'll need to be successful. I value this package at nearly $3,000, but I regularly sell it for 1/10 that price at $299. And on Small Business Saturday, November 30th, you can grab it for just $99. I hope you've learned a lot about diabetes today, friend, and I hope you use this education to save yourself, a friend, or a family member. Please share this video with them and make sure to subscribe to me here. If you'd like to start working together, you can just leave me a comment below. Until next time, stay healthy.